You know, I just discovered if you have YouTube Music, a subscription to it, and you try to make a video, it still plays. It doesn't shut off. Anyway, I just started talking out loud, so I figured, yeah, here I am. So I went to my IME appointment. It is a specialist that my work comp doctor referred me to for a second opinion. And they did warn me that they're, even on the paper you sign and everything, it says this is not a patient-physician relationship forming here. And it's right. They're very cold. They're just very cut, dry. You know, I asked him what his opinion was. He said, I can't tell you that. Okay. He said, it'll all be in the report. But he basically just asked me what happened. So November 1st, 2024, I was working with a patient, and I had just sat him up on the edge of the bed, and the door started opening. And I work in a skilled nursing facility. Okay. And the door started opening, and that patient in particular is under quarantine for his own sake. His immune system is compromised. So we can't bring anything into the room. It's not trying to not take it out of the room. So, a patient was trying to come in the door. This patient was in a wheelchair. He's very confused, a very confused patient. And I told him, I said, honey, you can't come in here. This is not your room. And he got agitated. I've been in there before, blah, blah, blah. And I was like, okay. Well, he was trying to roll his wheelchair. He kept running to the door frame, getting agitated, more and more agitated. So I bent over, grabbed the chair, you know, and I was going to move it so he can at least move, you know, stop being so agitated. Well, when I bent over, he punched me. Literally, yeah, he punched me right square in the chest. I told my ex this story. He said, you got punched by somebody in a wheelchair? Yeah, I did. Yeah. Threw me backwards. I guess I shouldn't have tried to help him. Yeah, I was very close. Threw me backwards, knocked the wind out of me. And I was startled. Like, I didn't realize what happened. I was just like, what? You know, it was so fast. I didn't even see his fist. I didn't. It was fast. And a guy that worked there, Eli, he was standing there when it all happened. And he's the one that confirmed to a nurse that was walking by. He just punched her. So I kind of needed that clarification. I was like, oh, that's what just happened. But being, you know, the hard worker that I am, and you just, you know, I had other patients I had to see, so I just didn't think much of it. I really didn't. Like, I've been punched in the head before as a CNA, you know, like, it kind of comes with the job. So I just kept working. And I think it was like 3 o'clock. That's what I told the IME. I think it was like 3 o'clock when that happened. So I only had a couple more hours left. So I finished my day, and I went home. Well, when I was finally, you know, when you get home, you relax. You're not focused and, you know, gone to go. So I was sitting on the edge of my bed. This is the only furniture I have. Sat on the edge of my bed, and I just started hurting. Oh, I started hurting. I called my mom. She told me I should go get a heating pad. So I went and got a heating pad. Then I got some Epsom salt, and I got some fragrances. Yeah. I brought it all back to the house. Soaked in the tub. Next morning, I couldn't sit up. Like, I had no strength. And it hurt. Like, I could not sit up. And I texted my boss, and I said, I can't sit up. She said, you probably dislocated a rib. But she didn't say it in those words. Okay. Just remember that. So I said, okay. She said, are you going to come to work? I said, I can't even sit up. So no. No, I'm not. She said, okay, well, you probably should go to the ER. So I went to the ER. I didn't even have a bruise. Okay. I bruise very easy. And I take baby aspirin. I have a blood clotting factor. My mother, she found out that she has it. And if she was on birth control. And I guess that did something. I don't know how she figured that part out. She's a nurse and I don't know. Ask questions. But it was a birth control that ended up giving her a blood clot. And because she didn't have this clotting factor that, break it down a little bit, she was telling me, I don't remember the story, but it was something happened in her room that terrified her. I don't know if she like fell on the floor or she couldn't breathe or something traumatic happened. And she got it checked out, and that's what it turned out to be. She had a blood clot. I think it was like close to her heart, her lung or something very vital. Yeah, so she had me tested because I'm a sick child. I always had everything. I had cancer, I always got sick. I had pneumonia twice. Then I always broke so many bones. I did. I'd come home, I'd be babying a limb. My mom would be like, what'd you do? Oh, I was an accident waiting to happen. That's what she said. Anyway, I finally grew out of broken bones. I hadn't broken a bone in a long time. Knock on wood. Damn, my dresser's over there. I can't knock on wood. Knock on wood for me. But anyway, so he threw me backwards, all that. Okay, I went to the hospital. I went to the ER, and the doctor didn't really even examine me. I didn't have a bruise. That's what I was getting at, because I didn't have a bruise. If you take aspirin, you bruise easily. I already bruised a little easy, but that's why I take a baby aspirin, because I used to take whole aspirin because I have a blood clotting factor missing. And my mom said, this is vital. You have to take an aspirin every day. And you cannot be on birth control that has the hormones in it. So I only can have like an IUD that's made out of copper or something like that. I can't have oral, I can't have injections. I can't have any birth control that has hormones in it. Yeah. Anyway, so I didn't have a bruise. So I think, they didn't take me serious. Let's just put it that way. I didn't have a bruise. And I told him the story, and he just went like this on my neck. He didn't even look at my shoulder. He didn't, I don't know. And then he left. Then I did x-rays, came back to the room. He didn't even come back. He's an assistant back and said, you don't have any broken bones, and here's your prescription. They gave me 10 milligrams muscle relaxer. And I told her, I said, this is not going to do anything, right? 10 milligrams. I have a very high tolerance to medication. I do. I think it's because of the chemotherapy they gave me. I don't know, but I have a very high tolerance to medication. When I used to take muscle relaxers for my hips, and she prescribed me 350 milligrams. It was a different type of med. They weren't the same name. But anyway, 350. And it still didn't knock me out my ass. Like, it didn't. And if it would take that, it would be zonked out. No, it didn't affect me like that. I hope it helped my hips. I really don't remember any traumatic difference. So 10 milligrams, I was very frustrated. So she said, what can I do to make this right? And I said, well, can you ask him if he can increase the dose or something? Because this is not going to do anything, and I'm in a lot of pain. I came to the ER, for God's sake. So, but no, he wouldn't. He said, you don't have no broken bones. So that's all you need. Okay. I went home, laid down on my heating pad. I stayed laying down for 4 days. Every time I sat up, maybe for 5 minutes, I was in a lot of pain. Gravity still affects me. Gravity. I even said that to, oh no. Hold on. So I went to the ER. Well, the ER person sent me to orthopedic work comp. Okay, I forgot that part. He sent me to orthopedic work comp. And it was like, yeah, okay, I got you. Yeah, but I went home. Yeah, I went home and I was there for 4 days. I stayed laying down. So I had an appointment. Yes, I had an appointment 4 days later. And I had to fill out this diagram about where it hurt. And I forgot to fill it out until the end. But she was the type of person that just wanted to pass my case along. She didn't really examine me like she should have, you know. The bad part, it was people at work or people I told the story to, they were more sad about him than me. They felt worse for him because he's confused. You know, it'd be horrible to be that way. You know, not know what the fuck you're doing. But damn, no sympathy for me. No, I was just supposed to be okay. And she acted the same way. Her main thing was, why are you still taking muscle relaxers? Granted, I just got them 4 days prior. 10 milligrams. I think I take it twice a day. Didn't do anything. And I just laid down for 4 days. So, in my brain, at this time, I was still in my head. And the only thing I could think about was, I'm going to lose my job. And that's my livelihood. You know what I mean? So I said, I'm fine. I told her, you know, I'm still in pain. I'm very discomfort. I called her discomfort. And she said, well, is it constant? I said, yeah. She said, then that is pain. So I learned something that day. I had such a high pain tolerance that I call stuff uncomfortable until it's painful in my eyes. But anything that's constant, a constant is pain. So then I said, yeah, then I'm in pain. But there was a diagram, and I didn't even fill it out, really. All I did was put a check, right side. Check right here. I didn't even fill out the back. It was the back that hurt. It felt like his fist went through my body. Yes. Because what hurt, this didn't hurt. It was really weird. This part didn't hurt. It was my spine and my scapula. That's what hurt. Like he went all the way through my body and hit my back. That's what it felt like. Yeah. But this didn't really, it was sore. It was a little bit, no bruise. So yeah, her main thing was, why are you still taking muscle relaxers? So she wanted to see me again because I was taking muscle relaxers. So in my head, I was just like, this woman's going to stop me from working because she thinks I'm high or something. And these don't do shit. But, so I lied and I said I was fine. And I had been laying down for 4 days. So I felt a little better. You know, I had limited gravity for 4 days. So I went back to work. November 7th. So that was November. The punch happened November 1st. November 6th. It was November 6th. Because I went back to work the next day, November 7th. And that's the day, that was the last time I worked. So November 6th, it was like towards the end of the day. And I had this patient. And he was somewhat confused too. So it was hard to direct him. And he was a solid man. So I tried to sit him up in bed. You know, you go like this and you sit somebody up in bed, right? Well, I got halfway and I felt something pop right in the spot that it hit, where I felt like his fist hit the same spot right there. Not here, you know, right by my spine and my scapula, right in that little area. And it popped. And I had like no strength left. I was frozen. Like I couldn't sit up anymore. And it hurt. So I had to lay him back down. I was just like, shit. So I I think I texted my boss. I don't remember. Well, the next day, I went back to work. I tried anyway. I worked with one lady. She was able to sit up on the edge of the bed by herself, so I didn't have to worry about that. And but she couldn't sit there. Her balance was off. And when I tried to hold her, if I tried to catch her from side to side, I couldn't do it. Like, I could not use this arm. It hurt. It had no strength. She was very unsafe. So I told him, I can't do this. And then she said, well, I guess you need to go to the ER. I said, oh, fuck the ER. I'm not doing that again. They didn't do shit. No. I just went straight to the source. So I went back to orthopedics, work comp. Yep. Well, come to find out, she was scheduled to have surgery in a couple weeks or something. But she was glad because she was going to pass my case on. But she already closed out my case for my punch. So she had a whole new case. But she really didn't examine me again. She really didn't. But she referred me to physical therapy. So I went to, forget what it's called. I had to write it down too. Anyway, I went to 2 different physical therapies so far. I'll tell you why. So I was referred to physical therapy. Went there, and he just like grabbed my arm and moved it over, and just moved it around. And come to find out, when I went to physical therapy at the other place, you're supposed to take measurements. He didn't take any measurements. That's how they know how you get better. Is your range of motion? Did your range of motion improve? He didn't take any measurements. No. But he was the one that told me my rib was out of place. They had taken x-rays at the ER, everything. They said, oh, you're fine. No. He's the one that told me my rib was out of place. So, okay. So in my mind, I need to go to the chiropractor, right? And I know a lady. That's who put bones back in place. Well, at the end of our session, I was laying on my stomach, and he kind of pushed on my scapula. Don't ask me why. I don't know. He just kind of pushed on it a little bit. And it caused me massive pain. Massive pain. Made it hard to breathe. When I laid down on my back, it felt like my bone was poking through my skin. And it wasn't like that before. Granted, I laid down for 4 days. I was fine. But no, this time when I laid down on my back, it felt like it was poking through my skin. Like, what did he do? So, when I went back, first thing I told him was, please don't push on my shoulder. You caused me a lot of pain. He said, what do you mean by that? What do you mean? What do I mean by that? I don't, okay. Anyway, he just kind of brushed it off. So when I left, I called my work comp lady that's been trying to pass the buck on me, and asked her if I could go to the chiropractor because my rib was dislocated. My rib was dislocated, and he's the one that confirmed it. And she said, well, can you get a referral from him? Come to find out, I didn't need a referral. I really didn't. But she didn't examine me. So she had nothing to go off of. So I went back into there. I hadn't left the building. I hadn't left the parking lot yet. So I went back into the building. And I went to the front desk. And I asked them if they could look back if they could look back in my notes from the previous, because you take daily notes. You're supposed to take subjective, what I say, and objective, what you observed. You're supposed to put that in there. And then what you did. What was your implementation? Implement, whatever. What was your intervention for the activity? Why did you do them? That's a daily note. Well, in the note, he didn't write anything. Nothing. No. Didn't even mention a chiropractor or I don't know. All I know is he didn't put down what I said, which is very, very vital part of the daily note. Anyway, so I went there and I asked him, hey, can you ask him if he could refer me to the chiropractor? I got a message. They have an app or something. And I got a message that said, I'm not referring you to the chiropractor. We'll talk about it at your next appointment. I said, I don't know, I don't remember what I said. I said something along the line of, I appreciate your point of view, but I don't need your permission. And then I went into detail about, you pushed on me and you made me really, you hurt me and all this stuff. And a chiropractor puts bones back into place. You are not a chiropractor. So I am going to the chiropractor to get my rib put back into place. Something along those lines. Basically, I hear you, but I ain't listening to you. You ain't the boss. I don't need a referral from you. I don't need your permission. She just wanted it because she didn't do her job. So I went there on my own. I know this lady personally because she took care of me before. During my last mental breakdown. She took good care of me. So I went there and she remembered. I hadn't seen her in 2-3 years. 2 years. Yeah, I hadn't seen her in 2 years. And I told her what happened. And that he wouldn't refer me. And that it's out of place. Please help. She gave me a birthday special, she didn't charge me. She put it back into place. She didn't do my neck. She didn't do anything else. She just put my rib back into place. For free. She did it for me. I was so grateful. Well, word got back to him, the PT, that I went to the chiropractor. He discontinued my service. Yeah, he did. He discontinued it. So when I went back, so I didn't have any PT or guidance or nothing for 2 weeks. And work comp was only going to pay for 2 weeks or something, like, or my job was going to fire me or something. It was dramatic. Like, I only had 2 weeks. And you cut off my service. So when I went back to my work comp appointment with that lady, I asked her if she would refer me back to PT. She said, they don't want you back. She said, you were too disruptive. No, I wasn't. In person? No, I wasn't. You just didn't like what I had to say. So I was too disruptive. I said, well, I wasn't impressed anyway. I said, I don't want to go back there. I wasn't impressed. She defended him. She was like, he does great. He helps people and gets them better and blah, blah. I said, good for him. I was not impressed. And he didn't even take measurements. Nothing. No. And you need to put shit in the daily note. What are you doing? I'm a PTA. I know how this is supposed to go. And I've been in physical therapy so many times. But I never hurt my upper body. No, it was always my hips. Anyway. So I asked her to refer me back to physical therapy. So she gave me options. She said, you can pick where you want to go. Okay, cool. So I picked the one right down the street, right across from the chiropractor. I can walk there. It's about 0.8 miles. Takes about 20 minutes, maybe. So I went there. She did measurements, everything, and it gradually stepped me through things. Well, it kind of got better. Then my central nervous system dysregulated, preventing me from progressing as fast as I should have. I couldn't use my hands. Couldn't put pressure on my wrists. Didn't really have a lot of range of motion like I should. I had my nerves were so tight. Nerves were so tight. They still are. Just not as bad. Anyway. And then I got referred to the chiropractor. So I went there. They have a massage therapist. I actually had a reaction to my central nervous system being dysregulated while I was with her. That's the only time it ever happened. And I was so glad I was with her, because I didn't know what the fuck was going on. My hands just started vibrating. Like, I don't know. I was in a seated position. I think I told her it was hard to breathe. It's kind of like when you have anxiety, but I wasn't having a panic attack. But it was like anxiety, and my chest was tight, and I was having difficulty breathing. You know, normal, relaxed breathing. And so I think she set me up. And all of a sudden I looked down to my hands, and they felt like they were vibrating. Have you ever held something that vibrates? Anything that vibrates. That's what it felt like. I just sat there for a while and just stared at them. I don't remember the rest of my body, but it was my hands that were the most prominent. Maybe probably the rest of my body. My feet still tingle. I couldn't step on them for a long time. My joints, everything hurt. Central nervous system dysregulated is no joke at all. But anyway, she told me what was happening, and she even said, "Lisa, you're safe. You are safe here." And tears just poured down my eyes. And she said, "Based on your reaction, yeah, you were traumatized, and your central nervous system is dysregulated." Because I wasn't crying. Tears just poured down my eyes. And then I couldn't move. Like, I didn't have, I don't know. She had to help me sit up, like, get off the table. Put my legs down. She had to help me. Anyway, so I had access to her. And then, so my work comp lady, she had surgery. So she referred me to another person in Hillsboro. So 45 minutes away. And he actually has taken his time. And I greatly appreciate it. But when I first went in there, first time he met me, he said, "Lisa, I need to see you get better." Because it had already been like 2 months. And I was still in the same boat. Granted, they cut my service off, and then my central nervous system, all this stuff. I said, "Yeah, I know. That's the plan. I want to get better." So I just continued, my physical therapy and the chiropractor, and I asked him to refer me to a massage therapist. Because they had massage therapy, but my understanding was they didn't have very many openings. So I wanted to go there at least once a week or more, something more than that. So he referred me to Strong Hands. Well, the lady I had, she even told me she was the most aggressive. She said, "We're all different, but you got me." And yeah, it was painful. It was painful. Yeah. And then he didn't put in the orders my neck area, because he just focused on my shoulder. Well, everything is attached. So if you are, for one, you're not really relaxing me. you're causing me pain. So all of my neck and my upper trap were like on fire, but she wasn't allowed to touch them because it wasn't in the documentation. So I never went back because I didn't see any benefit of it. You just shifted my pain to another area. Anyway, so I went back for the second appointment for my work comp with my new parent primary. And he asked me, you know, how I was doing. He asked me how much weight I think I could lift. I said, I don't know, I haven't tried. They haven't had me do that in physical therapy. They give me dumbbells. Max 2 pounds, max. I could tell you. And my weight restriction was like below 10 pounds. I couldn't lift anything more than 10 pounds. So I could not lift my dog. And come to find out, when I tried to pull on Kovu's leg one time to bring him closer to me while I was sitting in bed, it hurt my wrist so bad. So bad. Just to pull. And he's only 20 pounds. Just to pull him. Oh, my wrist. Oh, my wrist. It was horrible. And I really wasn't able to close my hands. But anyway, he asked me how much I could lift, and I said, I have no idea. And I said 50. He said, oh, no, I'm not going to start you out that high. Oh, no. Okay. So he put me on a restriction, which I am now. 20 pounds frequently, 30 pounds occasionally. But he wanted a second opinion. So he sent me to an IME. And that's where I went today. He had me do some range of motion stuff, but I basically just told him my story. He asked me, so you don't think you've improved at all with physical therapy? I said, no, I didn't say that. I didn't say that. I'm just saying it's taking a long time. He said, well, you think you're ready to go back to work? At the end, he asked me if I was ready to go back to work. I said, no. It's unsafe. I'm a PTA. I'm supposed to be able to lift you and make sure you don't fall. That's my job. Make sure you don't fall. Oh, they'll fall. Because I won't have the strength to hold them. Or it'd be too painful and I would, no. So, when I told my chiropractor that I was going to see an IME, she told me that he's not my friend. She said in her 30 years of doing her job, coming across work comp patients, only one time in 30 years that an IME suggested further treatment. So, I don't know. I don't know what's going to happen. Because I asked him what his opinion was, and he couldn't tell me. Or he wouldn't tell me. Whatever. I don't know. But I'm still on a weight restriction. And I haven't had PT. But they gave me a program to do, which I have not been diligently doing. I've been focusing on other things. So I'm really going to try to do that. I really am. I got to start. If I haven't started, you got to just start today and move forward. You know what I mean? If you haven't started something, you're like, shit, I should have done that a long time ago. Well, today is a new day. You can do it now and do it forward. So just keep that in mind. It's in the past. You can't change it, but you can change the present. Present now, what do you do now? And what do you do in the future? You can change that. So yeah, I don't know. I have my work comp primary doctor appointment on the 19th. I don't know. I don't know what to expect from here. I don't know if they'll just cut off my work comp benefits, saying you can't get any better. I don't know. But I can't go back to work. So you have to be fully healed. Fully healed. No, I'm not. The doctor even said my prediction of 50 pounds was way too much. So, I don't know. I don't see him just saying, pull the plug. Fuck it. I hope that's not what happens. I don't know. Lord, just help me. Whatever happens, whatever they decide, because, you know, you can't dictate what people decide. People have their own opinions and their own whatever. But just make me be okay.